everybody. You're listening to The Drive Home on 97.9 XFM and KJ Country 102.3.
All righty, gang, it's 4:30 on The Drive Home for a Thursday. Wayne, Tanya, and Brian all hanging around.
That's right, and we've got our guest on the line here, I believe. Dr. Jennings, are you with us?
I sure am. How are you guys?
Good. How are you?
I'm good. Making my way back from Greenville today.
Okay.
Okay.
Yeah.
Doing some traveling.
Yeah, well, I got a bigger job now. I cover Greenville, Shelbyville, and Decatur now, in addition to Effingham. I needed something to do in my spare time.
I see. All right.
Sure.
What are you doing, like cable sales? You out throwing up satellite dishes or something?
While I'm out, I might as well give it a shot.
That's right.
Yeah.
Hey, who knows? Hey, Doc, first and foremost, I guess that we might as well get the elephant out of the room here. Obviously, we've seen a spike in cases around the area of COVID-19, and that's, I know there's been a lot more testing done throughout the state. And so what do you attribute the rise in our area that we're seeing of cases?
You know, that is the elephant in the room. You know, when we kind of signed off of these interviews a couple months ago, I thought maybe you wouldn't have to hear my beautiful voice, but unfortunately, we have seen an uptick. Testing is part of it, no doubt, but reality is, we're seeing an uptick in visits in emergency rooms as well. So, the testing piece of it tends to pick up the people that are asymptomatic, otherwise didn't even know they had it, which has a very important role in the public health arena. But we're also seeing an uptick in people coming in with symptoms. Now, fortunately, it seems like it's a younger population, so it's kind of the 25 to 45, 50. I mean, I think when you look at the reports every day of new cases, it's a different demographic than what we saw when this first started, which is good news in the sense that those people generally do okay and don't end up in the hospital, as opposed to the older population. So, I really think it is a reflection of opening up, which is not a bad thing. We want to stay open, which I think is the name of the game.
Sure.
Businesses cannot survive this closure type of situation again. And so making sure that as community members, we're doing everything we can to minimize the spread of it so that our businesses can stay open. Like I said, good news is younger population, it's the population that got back out. I think the elderly population has continued to be much more cautious about returning to activities within the community, which in the long run may give us more people in the community that then become immune and have less chance of then spreading it from person to person. So it may help us to bend the curve in the long run while still not filling up the hospitals. So but the trick still is, the things we talked about. Masking is really a big deal. I know it gets a lot of argument around it, but reality is now that we're seeing so much more community spread, not spitting on each other helps. So
Yeah, right.
Wearing a mask does help to keep those numbers down, because at the end of the day, I can't imagine closing our businesses again.
Well, and Doctor, you brought up a point there about masks, and I want to ask you, and I kind of know what you're going to say from a medical perspective and from a science perspective, and that seems to be what a lot of people have pushback. When you start bringing up science, when you start bringing up medical facts, it's almost like we have this resistance against that. It's like you're taking you're putting a battery in the right way, and they're like, no, you can't do that. So if you wear a mask, you're protecting the other people around you from your airborne. I mean, I'm speaking to Tanya right now, and I'm looking at her, and there's stuff coming out of my mouth, right, that's flying at her.
You're exactly right, and
that's
there's
gross,
some really good and interesting pictures of people sneezing, and you can see it spray for 15 feet, and you put a mask on it, and the droplets don't go near that far. It just makes sense. And there is resistance around it, but it's not something new. I mean, we've, when's the last time you were able to go into a restaurant or a business with no shoes? My athlete's foot would do a lot better if I left my shoes off not to mention other things with rashes in various parts of your body, but you got to cover them up.
Correct.
So it's preventing contagion, just like the no shirt, no shoes, those types of things. All kind of fit into the same idea. But for me, I mean, certainly I don't want people getting sick, which is the big key in point. But for our community, if we let things bubble up and get to the point that Restore Illinois slides backwards on us, businesses will close. People will lose even more jobs. It's important that we keep our numbers down.
Now, I have a quick question, which these probably go hand in hand. The accuracy of the test, because there are some places you can get the results back in like 15 minutes. Some places you can get them back in 2 to 3 days. Sometimes it's maybe over a week. Are the accuracy of like a 15-minute test versus a 3-day test, is one better than the other?
So a lot of the turnaround reflects the testing capacity and the volume of testing, but it's really about the type of the test. And so the gold standard tests, like what's performed at the hospital and like what has to be done prior to surgery, is what's called an RT-PCR, and it's kind of the gold standard, if you will, that is the one that is the most likely to detect the disease if it's present. And at the same time, because there's two sides to testing, you want to test to be sensitive, meaning if you have the disease, it will identify it, but you also want it to be very specific, meaning that it doesn't give you a positive test when in fact you are not sick. And the difference between the RT-PCR, which is a little more complicated, a lab-based test, not something you can just go to, a 5-minute turnaround type facility, is the one that carries the highest sensitivity and specificity. The other ones are based more like home pregnancy tests or those types of things, a little bit different type of testing strategy, not as sensitive, not as specific. Interesting use for some of the public health stuff, again, to try to just get an idea how much is out there, those types of things. But to really make decisions about the care of an individual, their well-being, help them to make decisions about survival and things in these situations, you need to go to the gold standard. So the drive-through testing facilities are still out there that do go to the state lab, which is RT-PCR. Perfectly reasonable, but the turnaround times have slowed because the state has opened up a lot more testing centers, which is fine, but then you got that many more tests to run and only so many people to run them, and so it runs into slowing down the turnaround time. It gets to the question of when do you need tested, really. Right. And I think it's interesting to test people that are well from a public health standpoint, but that's a different agenda than the hospital needing to test people because they're sick to help make decisions about how we're going to care for them, advice that we're going to give them on their prognosis. And so, the hospital does testing, but we generally reserve our testing for situations just like we were at the beginning of this, where it's going to change the decision-making on how we care for a patient. Testing somebody that's not necessarily sick or was just exposed to somebody, because they were at a pool party or whatever, that's a public health role. They're well. It's not going to change my advice that I give them, which is, to isolate yourself if you're sick, wash your hands, wear your face mask. You shouldn't have gone to the pool party to begin with, maybe.
Now, for those asymptomatic people that, aren't showing signs, but they were maybe exposed by someone that did test positive, where's the best place for them to go to get tested?
Yeah, what are the options?
So right now, the kind of open testing, if you want to call it that, the closest facility for Effingham is right there behind Building A on our property that's done by the Federally Qualified Health Clinic, Southern Healthcare Foundation, which is the Federally Qualified Health Clinics are generally where you're seeing that population-based testing going on because they receive federal grants and state grants to perform that type of testing. And actually this week, the state's popping up drive-up tents in Bond County and the county south of that, I believe. I'm blanking, but which is Greenville area. That's why I happen to know it. I was coming to Greenville.
Yeah,
there
Greenville.
you go.
So, and that's on their website. They'll talk about locations, that where they're doing some additional drive-through type testing, and always have their testing facilities in general that are there all the time posted. Because the one behind the FQHC, both there in Flora and Clay County as well as in Mattoon, are done to the FQHCs, and they've been there for quite some time. Great resource if you're asymptomatic, you have a concern, maybe you think you were exposed or you were exposed, and you've got a visit coming up to see grandma, and you sure don't want to make that mistake. Reasonable strategy. The problem's just the turnaround time is generally a couple days.
Okay.
Interesting.
Now say, sorry, I'm hogging all the questions.
That's all right.
But say you tested positive and you quarantined for 14 days. Do you need to have another COVID test to make sure that you're testing negative?
Wow, did that turn into a big ball of fire for us?
Really?
When this first started, we really thought that was the answer. That you'd retest people, say, hey, you no longer have the virus. You're not shedding it anymore. You're good to resume your life. Congratulations. And what we found is that folks continue to shed viral particles that don't necessarily be contagious, but they shed them for weeks and weeks and weeks and months. So we've had folks that when we started this strategy, and not necessarily at the hospital, but in businesses, where they started using what they called the test-based strategy, which is exactly that if you had a positive test, you have to have 2 negative tests to be considered not infected. And they've been out of work for 16 weeks feeling great for the last 15.
Right.
And so actually the CDC last week, I think on the 17th, changed their guidelines and it started to recommend a purely symptom-based strategy for allowing folks to return to work. And it's actually now 10 days from the onset of your symptoms.
Okay.
So, if you get sick, then you have to wait 10 days from the onset of your symptoms and 24 hours without fever if you had fever to begin with. So 24 hours without fever, without using Tylenol or ibuprofen to cover it up. I've never sent a child to daycare with giving them Tylenol, Motrin, never. And improvement in whatever their symptoms were. So, if they had cough, the cough needs to be improving. They need to have no fever for 24 hours, and it needs to be 10 days from whenever their symptoms began, which a couple of those things changed from the previous recommendations, which were 14 days and 3 days without fever. So, information continues to evolve, but definitely we found out that the test-based strategy has really kind of turned around and been a problem because you can't ever liberate people because they just continue to shed viral particles.
So that's kind of, just like the common cold, with fever, no fever for 24 hours or, stuff. In isolation, of course.
Yeah, symptom-free.
Yes, but what you're kind of describing is just what we would normally get. A common cold with a fever and a cough, and I'm not saying that that's what this is. I'm not saying that at all.
Other than the 10 days, so it's 10 days and.
Okay.
So if you started coughing on day 1 and had a fever, and all that goes away day 3 and you feel better, you still have to go 10 days from when you started.
Okay.
Gotcha.
So it's 10 days and 24 hours with no fever and symptoms improving.
Gotcha. All right.
Tying in with that same vein, I guess you could say, with these changes that you just mentioned, that the CDC has, had more time and data to analyze and come up with a strategy. That's all fine. So who tells the patient that? When I don't know how this testing communication gets done. Imagine somebody calls you or whatever, and they let you know this and everything we've just been discussing about 10 days or symptom-free. Do they tell you what to do, or do you need to then contact your primary care physician again? What do you think?
So all positive testing, now certainly if you've not heard the results of your testing for whatever reason, track it down because, there is a little bit of, we're not going to call you if it's negative, but that doesn't always work because, maybe I just didn't see the result for whatever reason. And then you're running around positive, you don't know it. So, I do think it's important to, if you've not heard from your provider in the expected amount of time, to give them a call and go, hey, have you seen my test? Oh, it's negative. Great. Now, all positive testing, regardless of how that testing is performed, whether that's done, at your doctor's office, at the hospital, et cetera, all positive testing has to be reported to the public health department so that then they contact you, will go through all the rules, identify contacts, the contact tracing element of it, those types of things, because then, again, that moves from the pure medical arena into the public health arena.
Exactly.
Gotcha.
All right.
All right.
Don't not call for your results.
Gotcha.
Track them down.
It's too important.
Yes.
I know Dr. Jennings loves when I throw cold questions at him, but something we talked about that he mentioned earlier made me think of this. Doctor, how important is it that maybe people who are out and about on a very regular basis maybe try to keep track of where they've been should something come their way? Because contact tracing is really important, is it not?
It is, and honestly, it's become so much harder because of that. People have been out and about more, and you go, well, where were you in the last 4 days? And folks are like, well, heck, I don't know. We were shut down. You went, well, I've been on my couch, but now it's like, well, I think I went to El Rancherito, maybe, I don't know. And, and so it is kind of important to kind of be aware of your surroundings, and certainly where there's large gatherings. The only thing that is reassuring in that, though, is for the largest part of this, it requires a prolonged and fairly close exposure. So 15 minutes at less than 6 feet from somebody is kind of the rule of thumb, thus the 6 foot social distancing idea. So, if you pass somebody in Walmart, either if you have it or they have it, you're not likely to infect each other. I think not last time I was on, but sometime when I was on in the past, we kind of talked about the Trek Trail and that type of thing. And, generally there, you're not having prolonged close contact. You're passing each other.
Sure.
So that rule still applies, which does help with the idea that, undoubtedly some of those folks that have recently tested positive have, been to a restaurant, been to the bank, been to a grocery store, et cetera. So that's reassuring, but it is helpful to be able to go, well, I was in close proximity. I went to the bank for a loan and was sitting at the desk for, 45 minutes with the bank guy. That's a close, prolonged contact.
All right. Doctor, we went long on this, and thanks you so much for the time. I got to say, you name dropped El Rancherito, just so you know the cheese sauce is really good, but it won't protect you against COVID, right?
That is truly a fact, and my daughter would agree with the testimonial. So, I appreciate the time, guys. Thank you guys, WXEF, and KJ for getting us on, man.
Absolutely.
Thank you so
Drive
much,
safe,
Ryan.
Doc. Thank you so much.
All right.
Have a great night.
Bye-bye.
You too. Bye-bye.
There you go. There's Dr. Ryan Jennings, Chief Medical Officer of St. Anthony Hospital here in Effingham. Always proud to have him on the air here, and a lot of folks with a lot of questions, so we're glad we gave him a forum.